For me, social work is about having impact. You want to work in an area that you feel like you're making a direct impact in the lives of other people.
It's about bringing hope to the world when hope is quite limited. It's about bringing in a level of belief in the human capacity to change and in social justice.
Social work means a link. I see it as that link between psychology and sociology. And I feel like social work allows us to have this kind of holistic view of people and how people behave and function in society and how we can reach and help and support them.
Social work's a really interesting discipline because it draws upon other academic disciplines. So my professional background is as a youth worker. I'm really interested in social work from a sociological perspective, which means that I'm interested in the way that individuals fit within their social context and the way their social context acts on their lives and constrains their choices and gives them opportunities.
Part of my job in social work as lecturer in environmental impact and wellbeing is expanding the minds of social work students to think about the ways that the environment can impact human wellbeing. And so traditionally in social work, we see that as being the social environment. And so as part of my job, I'm trying to expand that to include the natural environment as well. So the physical spaces around us and how that can potentially impact people's wellbeing.
I've been working as a public health officer for over 15 years here in Australia. So my contribution to social work is bringing that critical thinking, using evidence, using data to kind of make decisions. And not only that, also working with communities, because public health, we work with communities, we work with populations. Engaging community in co-designing intervention that's going to be acceptable and appropriate for the community.
My background is in psychology, and I worked a lot in addiction and addiction science. And then I decided to do a PhD, but I did it in public health. I wanted a broader lens to what was happening with people and for more focus on the health perspective beyond mental health only.
Social work offered me opportunities that were very, very broad. Mental health has been where I've landed over many years of a journey, and it wasn't necessarily where I started out, but at the same time it's just been a wonderful journey. I love the profession.
Prior to joining Flinders University, I worked in industry in the Department for Child Protection for over 20 years. Working with the most vulnerable children, young people and infants in the state is something that has left a lasting impression on me.
I've worked in social work education for about 12 years now. I actually just stumbled into social work. I didn't grow up thinking, oh, when I grow up, I want to be a social worker. And I remember walking into the first class when I was an undergrad, and it was the first time I actually saw a woman who was a professor. This is back in my country. It was a confrontation of my own ideas. And so when I remember her, I think about a lot of the values and ways of seeing the world that she really supported us. My life and my career was fundamentally changed by a good teacher. And so I take it seriously and I take it personally.
I have worked with hundreds of students in my time. What I'm proud of is seeing the depth of understanding and seeing students be able to not just theorise, but actually make sense of it in the real world and in complex situations.
I had the opportunity to work in several different countries throughout the Americas. Within my context, social work isn't very recognized, but I saw the need for it. And so for me, it has helped me to be very passionate about the role of social work and the necessity of social workers and the impact that social workers can make in creating and sustaining change. And I noticed that in working with my students, they really value that. And that opens their perspective and their interpretation of what social work's role really is and how it can be applied.